everyone. My name is Mary Beth and I'm a student physical therapist assistant from GTCC. I've spent the last 4 weeks learning what it is like to be a PTA at friends' homes, and today I will be talking to you about dead butt syndrome. So what is dead butt syndrome? Dead butt syndrome is also known as gluteal amnesia or Gluteus medius tendinopathy. The muscles are still there, but they do not activate as they should. So the gluteal muscles forget how to engage during activity. The most common side effects with this syndrome are pain and stiffness. Have you ever heard of the phrase, sitting is the new smoking? So the population that is affected by this syndrome are people who spend the majority of their time sitting. Living a sedentary lifestyle causes the hip flexors to tighten and the gluteal muscles to lengthen. The over-lengthening of the gluteal muscles puts a strain on the tendons that connect the muscles to the bones. When you go to stand up or take a step, you may experience pain because you no longer have the needed support these muscles are supposed to provide. So, the muscles that are involved are the gluteal muscles, including the gluteus maximus, gluteus medius, and gluteus minimus. The gluteus medius has some extra stars up there because it is the one that is most important. The gluteal muscles support and stabilize the pelvis in addition to assisting with activities such as walking, standing, sitting, and other things. The gluteus maximus is responsible for hip extension and lateral rotation. The gluteus medius is responsible for hip abduction, medial rotation, and lateral rotation. The gluteus minimus is responsible for hip abduction and medial rotation. And the gluteus medius is the most important because it is what stabilizes the pelvis during gait, during your walking. The gluteus minimus helps with that, but the gluteus medius is the one that takes the most of the work, majority of the work. So, why does this matter? If these muscles are not doing their jobs, then the body tries to compensate with others. Whenever the body compensates with other structures or muscle groups that were not designed to accept the stress you're giving it, you cause more damage to your body. This is why the pain could start to travel to your back, your hips, knees, and even ankles and feet. So for example, the gluteus maximus should help the back muscles when lifting a heavy object. So you see the red right there, that's the gluteus maximus, and then there's another red right there, and those are some back extensors. But if it does not activate correctly, you're putting more stress on the back, which could lead to pain, strain, a muscle pull, things like that. The gluteus medius should hold the pelvis level when walking, but if it doesn't, the shearing of the tendon on the greater trochanter can lead to greater trochanteric bursitis, which is an inflammation right here.
This is the first part of that sentence to use your
Clicker. Okay. So the gluteus medius should hold the pelvis when walking. There's the gluteus medius muscle right there. But if it doesn't, the shearing of the greater trochanter and the tendon, which is this white part right here, can lead to greater trochanteric bursitis. So there is a bursa right in here, and it will become inflamed, which is painful. These are just two examples of the many problems that can occur if this syndrome goes untreated. So how can I prevent it from happening? This syndrome is easier to prevent than it is to treat. And what I mean by that is these muscles can become deactivated faster than the time it will take to reactivate them. So the prevention is simple. You just have to get up and get moving. If you sit for long periods of time, you should be getting up about every hour to stretch, walk around, or at least change position. The next level is to get involved in an exercise program, which can be as simple as going on long walks or participating in exercise classes that would involve strength, flexibility, and even some cardio. A few examples of great exercises for strengthening the glutes specifically are bridges, which if you've been to therapy, you've probably done bridges, clamshells, another one, squats, and another one is going to be your side lying leg raises. So this next slide is going to be a video that goes over clamshells and the side lying leg raise.
This one is called a clamshell exercise. So you're going to lie down on your side. The big thing with a clamshell is you want your hips to be perpendicular to the floor. If you roll your hips, you're not really going to work that muscle like it should. So if you have to start off leaning against the wall, that's fine. But you want to keep it straight up and down. Your knees are going to start off together, and your feet are going to start off together. Your feet are going to stay together the whole time. And then the top knee is just going to come up like a clamshell. So again, make sure that hip stays still. So if you come up and do this, that's not doing it right. You want to just come up to where those hips stay in one spot. So it looks easy, but if you're doing it right, it's a lot harder than it looks like it. So just coming up and then slowly coming back down. So just start off with about 10 of these, and you can work your way up. If you get to 20 to 25 and it's pretty easy, you can put a weight around your thigh, or you can use a resistive band and then do that as well. But remember, if you start rolling that hip, then you're not doing the exercise correctly. The next one is going to be just a side lying leg raise. But again, this one has to be done correctly for it really to work that gluteus medius muscle. So you're going to put the top leg straight out. That's the one you're going to work. And you want to keep it nice and straight. When you lift it, you want to lift with your heel up and your toes down. So in this position. If you're going up like this, then you're working your quads and you're not working that glute med. And when you come up, you want your body to be in a straight line. So you don't want it to come up this way. So kick it back behind you just a little bit. So you're coming this way versus a lot of times people want to come up this way, but see how it comes forward. So you really want to kick back behind you. So again, just starting with about 10 to 15 of these. If you get up to 20 to 25 and it's easy, then you can start adding some light ankle weights. But again, you should feel that work in that glute medius right there.
Okay, so the question that everyone wants to know, do I have dead butt syndrome? And there are a few exercises you can do to see if you have this syndrome, and those are going to be a Tendinopathy test, a single leg glute bridge, and looking at your squat position. So the Tendinopathy test goes back to when I was saying your gluteus medius helps stabilize your pelvis when you're walking. Okay, so that is your gluteus medius right there. So it is going to pull down to lift this other half of your pelvis up when you're taking a step. Your pelvis is supposed to be level when you're walking. So if that doesn't happen, when you go to take a step, your pelvis is just gonna drop down and it will not hold your pelvis level. So that's one way. You can stand on one leg and just see if you can hold the other leg up. This is a fancy word, but in a reversal of muscle action, the gluteus medius prevents the opposite side of the pelvis from dropping when standing on one lower extremity, which is what I just explained. A single leg glute bridge is an exercise where the glutes can be more isolated than when performing a double leg bridge. So if you do this, it's all about like sensation. So if you can feel your glutes engaged, that's good. But if you feel like most of the work is coming from your hamstrings and quads, those muscles could be taking over and taking on the load that your gluteal muscles are supposed to perform. So these muscles are involved and you will feel them, however, they should not overpower the exercise. And now if you look at this squat, okay, your knees should be in line with your toes. There's a yellow line pointing from the knees down to the toes. When you perform a squat, if your knees drop in, that is a sign of weak hip abductors because you're not able to hold the leg in position. The knees fall in when you start to go down into your squat. So that is also a good sign for weak hip abductors. Okay. And so, if you think you have dead butt syndrome, or you just want to go and see if you have it, then go see your physical therapy team, where they can give you your proper assessment and treatment to help you with this syndrome. Are there any questions?
When are these activities testing?
What are they testing?
When are they starting?
When?
I know you do it regularly if somebody was in, but now I want to go in.
During your therapy treatment is when you would do the testing and then the exercises with your therapist.
Is there some times now we can sign up?
Yes.
Okay.
Please repeat the question.
They're gonna be work.
I don't know what she's asking.
She was wondering when she gets that as part of her therapy, when she get assessed.
If I can't hear her, I can't make a better judgment at all.
Nobody can hear her.
She said no one can hear her. She apologizes.
Yeah, I can't hear much of anything.
Any other questions or anything you need to repeat? Okay, well, thank you all for taking time out of your day to come listen to me talk about dead butt syndrome.